Hello, I'm Pamela Lindsay, the founder of the BC nonprofit Whole Human Foundation. The purpose of our foundation and events like Whole Human Summit are to democratize health knowledge, to bridge worlds in the healing space, to create connections between thought leaders, and this year to specifically help identify barriers in health and drive solutions so that we can build healthier, happier, and more equitable communities. I'd like to thank all of the Summit team, including our speakers today, for putting this talk together. And thank all of you for being here today and let you know that your participation in the Summit is important for driving the improvement of our healthcare systems and driving solutions. I encourage you to continue the conversation beyond today in our Slack chat group. And I also want to mention a big thank you to our supporting and community partners for helping to make this Summit series possible. So now I am honored and delighted to introduce Dr. Lucy Lyons, our conversation facilitator this evening. Lucy is a family physician in Vancouver with 20 years of clinical experience. She trained in medicine at UCL and also studied neuroscience there, with research on neuroreceptors in the spinal cord to modulate pain states. She believes in exploring and supporting our innate homeostatic mechanisms in our physiology and in the brain, which, when properly supported, can facilitate true healing and provide a foundation for all realms of health. She teaches that by intentionally unlearning the effects of our modern culture on our unconscious, real health is possible. Lucy specializes in providing MSP-covered group medical visits by telehealth, teaching mental training exercises, and emotional offloading for patients with anxiety, insomnia, and chronic pain to deactivate their sympathetic nervous systems. She has a private practice teaching creativity mobilization technique, also called mess painting, done in a no-thought state, which brings the unconscious into consciousness, allowing the individual to realize their authentic self. Lucy is a member of the Faculty of Medicine at UBC, and she is co-chair of the Vancouver Coastal Health Physician Wellness Committee, driving systemic change across the region to support our doctors and reduce physician burnout. Let's all welcome Lucy, who will first be opening our summit session with a very important acknowledgement of the lands in which we are gathered upon today.
Thank you, Pam. We'd like to acknowledge the traditional, ancestral, unceded territory of the Musqueam, Tsleil-Waututh, and Squamish First Nations, on which we are privileged to learn, work, and play today. Arriving here as an immigrant 3 years ago, I was unaware of the extent of the efforts needed to transform the struggles Indigenous peoples face every day. I would like to take this opportunity to commit myself to the struggle against the systems of oppression that have dispossessed Indigenous peoples of their lands and denied their rights to self-determination. In this summit session, I would like to particularly honour the wisdom of Indigenous peoples here and across the world. I dream that we may all learn to live consciously in such a way as to respect and learn from this precious land, always aware of its finite resources. By exploring our consciousness, may we understand that we are not separate from each other or the universe. So today we're going to follow on from a fascinating session last week where we looked at the longitudinal healthcare system and how that can best serve whole human health. So I'm really happy to be here today. I really have really luck and luck to thank for this. I met a friend in South Africa some years ago, and together with our shared love of scuba diving, I met Dali. So thank you so much, Dali, for connecting me with this community and being part of this today. So as you've heard, this event is very much audience driven. We'll continue the conversations that we start today on the Slack channel, which I've personally found is so much easier on a laptop or PC than it is to try and navigate on a phone. Okay, so The substances we are talking about today are in the context of psychedelic psychotherapy. We are not advocating for illegal or recreational use. I'm really excited now to introduce Devon Christie. We met for real a few weeks ago on the beach to try and plan the session. And in fact, we should have made a recording of that where we got to know each other. So many insights. Devon is a family doctor with a focused practice in chronic pain management and is medical director with Numinus Wellness Inc. She is a certified functional medicine practitioner, mindfulness-based stress reduction teacher, and relational somatic therapist. Devon was trained as a research therapist for a phase 3 study funded by the Multidisciplinary Association for Psychedelic Studies, investigating MDMA-assisted psychotherapy for post-traumatic stress disorder. Devon is devoted to helping people uncover the root causes that lead to illness, to connect with the wisdom and intelligence of their bodies, and become active participants in their well-being. She's speaking on the subject of psychedelic-assisted psychotherapy today, with some dialogue between the two of us. We'll then split off into breakout rooms for 20 minutes or so, and come back together for some final questions and insights at the end. Over to you, Devon.
Thank you so much, Lucy, and thank you, Pam, and everyone, all the volunteers helping to make this summit possible. Thank you for that beautiful land acknowledgement to start us off. So I'm really excited to be here contributing this to the dialogue that's unfolding in this summit, speaking to real innovation in what's possible in treating mental illness, and also even further possibilities with this renaissance of psychedelic research, and how that fits into really an evolving paradigm for whole human health. So I will just give a disclosure quickly here. I'm a medical director with Numinus Wellness, as was mentioned in the intro, which is a publicly traded company aiming to create an ecosystem of solutions around safe and evidence-based accessible use of psychedelic-assisted psychotherapy. And I am a holder of options in this company. So I wanted to start with this image, which to me evokes so much. This and all of the art in the remainder of this talk are from my very favorite visionary artist, Autumn Skye Morrison, who's a British Columbian from Powell River. And when I see the figure in this image, it to me evokes something of what's happening in our collective right now. You know, there's this person, they're naked, they're alone, they're kind of on like a digital matrix. We're so plugged in digitally now more than ever, and kind of shrouded, surrounded in darkness. Yet looking up, there's butterflies, which are a symbol of transformation, among other things. And to me, there's a message of hope, and that we might be able to move forward together with new solutions, creative solutions, to create a better reality for all of us to heal and be well, and with all of our relations on this beautiful planet. So whole human health, I think in the description of my talk, it said that I was speaking to this new paradigm, but really there's nothing new about it other than this, we're living in the modern world with modern technology and science, and really the roots of what I'm speaking to is actually in many very ancient world traditions, including indigenous traditions. For example, many indigenous peoples have something known as a medicine wheel, a particular medicine wheel I was taught in through a Siksika Blackfeet elder, depicts that there are elements of our being that we really, in order to be integrated and well and in balance with ourselves and with each other in the world, we need to hold in balance. So in this particular image, one of the things that can be represented on a medicine wheel are balanced attention to health and wellness of not only our physical bodies, but also our minds, our emotional world, and also the realm of spirit and how we relate to spirit. Traditional systems of medicine, such as Chinese medicine, Ayurveda, and other very ancient medical systems.